Hi, you're listening to Journeys in.
So my name is Dr. Martha Cline. I am a board certified veterinary nutritionist. I work for Nestle Purina Pet Care as a veterinary communications manager. Prior to joining Nestle Purina last year, I worked full time as a clinician, practicing clinical nutrition full time in small animal at Red Bank Veterinary Hospitals in New Jersey.
Okay, perfect. So if we can kind of go around with kind of how you got started into going into nutrition, kind of like where did you go to vet school, and kind of like what made you think that nutrition was the route you wanted to go?
Yeah, so I went to veterinary school at the University of Tennessee in Knoxville, Tennessee, and I was looking for a job between my first and second year of vet school. I had also, during my first year of veterinary school, applied for a student rep position with Nestle Purina and got that position. And there was an opportunity for me to do a research project with the nutrition service at the University of Tennessee as a summer project between that first and second year. And so I spent the entire summer working with the nutrition service, participating in a research project, and really found something that I was really interested in. I didn't even know you could be a specialist in nutrition, but it was something that was really interesting to me and something that I really enjoyed doing. And so I started pursuing it as a specialty after that summer.
Perfect. So great. Can you kind of walk us through the journey into your specialty? Just like you said before, you didn't really know that you can specialize in nutrition. So how does one get started?
Yeah, so when I was interviewing for veterinary school, I knew that there were certain veterinarians that did specialize in certain areas, but I really fully did not understand the process of specialization. And so once I realized when I was in veterinary school that I was interested in something very specific, like small animal cat and dog nutrition, I started on that path of trying to become a specialist. And so through that process, during veterinary school, I focused a lot on different opportunities in nutrition. So when we did our externship, so you have an opportunity during your clinical year to spend some time outside of your hospital. And so I specifically selected places to go that had boarded nutritionists where I would get to be able to see what it was like in clinical practice. Following veterinary school, during my fourth year of veterinary school, I applied for a rotating internship, which is typically a precursor to a residency program. And I applied to a hospital that had a boarded veterinary nutritionist practicing there. So I would have the opportunity to spend some time with her as well. And then during my internship is when I applied for my residency program and was hired to actually come back to the University of Tennessee to pursue my residency program. And so, and again, a lot of the electives that I took in veterinary school, if there was an opportunity for me to take something that was related to nutrition, I would take that. I spent a lot of time. I actually rotated within the University of Tennessee through the nutrition service. And through all of that, it really solidified the decision that I made that I wanted to pursue this particular specialty and field.
That's amazing. Nice. So what is a veterinary nutritionist? Like, what is some of the things? I know there's a lot of routes you can go with nutrition, but like, can we kind of describe a little bit of like your typical roles and responsibilities in your current job, and as well as the job that you had before and more clinical based?
Yeah, so the job of a veterinary nutritionist is, even though it's a narrow specialty, there's a ton of opportunity within the veterinary nutrition specialty. And so it kind of starts initially with just the board certification process itself. So I'm a small animal, so my specialty was in cat and dog. It does encompass some small exotics as well, but really the focus for me has been cat and dog. There's also a comparative track, which is doing a combination of both large and small animal. So you get the equine, the bovine, and all of that in addition to cat and dog. And then there you could also specialize in just large animal. So like I was just small animal, you could also only do large animal. So even that obviously opens up a lot of different doors depending on which kind of track that you would go in. So if I did large animal, I would be in a completely different situation than I would be right now. So for small animal, generally kind of the three branches that we think about that you can go into are clinical practice, academia, or industry. And in each of those sectors, there's going to be some differences. There are also some boarded nutritionists that work within government as well, so USDA and FDA, which is really interesting, actually. I think that the whole regulatory side of everything is really fascinating, and so that's another opportunity as well. You have the opportunity to go into more kind of regulatory or government role too. And so going back to the other, which is the clinical, the academic, and the industry, within the clinical setting, we're really looking at private practices, and that can either be within a large hospital, which is how I practiced for many years, and I still practice now. So I work part-time at Red Bank Veterinary Hospital and see cases there on a limited basis. And so this is a large specialty hospital where there's multiple different specialists, emergency services. There is some general practitioners there as well, but you have the opportunity to interact with all kinds of different specialists. There are also people in clinical practice that do it independent of a specialty hospital. So they are running their service typically through teleconsulting. So they'll provide telemedicine consults, and they'll be open really to any hospital or any individual that is interested in having a consult for their pet. And so there are some differences in how those are run. When I was at Red Bank, I primarily saw cases in person, which is what I do now. I see cases in person. Obviously, during the pandemic, that changed quite a bit. So there was a period of time where I was only doing teleconsulting or telehealth, and then I was doing a hybrid for a while. But now I'm pretty much exclusively back to in person, which at least personally for me is what I prefer, but there are other people that prefer to do the teleconsulting. Within academia, there are roles that are more clinical based. So they're going to run more clinical services and provide support to the hospital. Or there are going to be some nutritionists that are going to be more research based. Within the academic appointment, there's going to be some clinic, some teaching, and some research. It's just what percentage is going to fall into each of those different hats. And it kind of depends on what your position is. If you're a tenure track faculty, if you're a clinical track faculty. So that's all going to just be dependent on, again, your individual appointment. And then within industry is really unique because it's going to be different depending on what company you're working for. If you have additional credentials like a PhD or something like that. So within industry, what I do is primarily communication based, which is something for me that it's where one of my strengths lies, is more on the communication front. And so we primarily communicate with veterinary professionals about the research and development and product that happens within Nestle Purina. And then our specific team, we also work specifically with universities, not just on that communication front, but also looking for opportunities within well-being and DEI initiatives and all kinds of really cool things that I really didn't have the opportunity to do. And so that's been a really interesting part of my job, is getting some of those unique opportunities for service, really. But I really enjoy talking about research and science and trying because of my private practice background, is having the ability to take something that might be really complicated from a research and development standpoint and being able to communicate that out to the public and even to the veterinary profession and make it something that's clinically useful to them. Also within industry, as a veterinarian, people can work more on the technical side, work more on the research and development side. There's a lot of different opportunities. And again, it kind of just depends on which, it can vary based on the company itself. And so there are some companies with nutritionists who their roles are to coordinate with other companies and to provide services to them, like more on a consultant type basis. And so there are just tons of different opportunities from that standpoint. Within all of that, the things that I've excelled at, that I feel really comfortable in my niche, is again that actual clinical practice, and then also the communication of tools and resources related to clinical practice, really to kind of benefit the greater good. So that's where you kind of get into it from the industry standpoint, is it's not a one-on-one thing. For me, on the industry side of things, I have the ability to help thousands and thousands of animals, where on the clinical side, you're kind of a more on a one-on-one basis, which is really important too. And now I get to do both, which is even better. So
I think honestly, it's really interesting how like you're using your professional background and kind of applying it in different areas one might not think it would be used for. And just like when you pointed out, like even how specialized nutrition is, there's so much you can do within that. And I think that's really amazing. But like I have a question kind of going on that board certification.
mm-hmm.
And I've been looking at board certifications and I'm like, this is a very intense process. Can you kind of walk us through a little bit of what that process is like?
Yeah. So the board certification process and specialty is really, again, going to depend on which specialty college that you're looking at joining. And so the nutrition college has actually undertaken quite a journey in the last couple of years. So our college used to be called the American College of Veterinary Nutrition, so ACVN. In 2021, so just about a year ago now, because it's October 2022. So October 2021, the ACVN merged with ACVIM, which is the American College of Veterinary Internal Medicine. And within the American College of Veterinary Internal Medicine, there are 6 subspecialties. And so nutrition became the 6th subspecialty of the ACVIM. Other specialties are, and I hope I named them all correctly, but cardiology, neurology, oncology, small animal internal medicine, large animal internal medicine, and now nutrition. And so for people that want to be cardiologists or oncologists or neurologists, they're all going to fall under that umbrella of ACVIM. But they're going to have that specific subspecialty. So within the nutrition college, this is a bit of a dynamic time to talk about what credentialing looks like. I can tell you guys what my credentialing looks like, and then what likely credentialing will look like for nutritionists in the future. I'm not on any of those committees, and so I don't necessarily want to speak out of turn in that, but my credentialing process when I joined the American College of Veterinary Nutrition in 2013 involved initially you have a certain number of days that you have to be on clinics under a mentor. So that is one thing that you have to do. You have to have a certain number of rotations outside your specialty, and they have to be within specialties that will be related to nutrition. So I did internal medicine. For example, I did critical care is another one. I actually did avian and exotics is another one because, again, we have some avian and exotic exposure as well. I also had to publish original research. And so, and this is something that will transcend even into the new credentialing process. But as part of your residency program, and this is really across the board with any residency program, is that you have to do a research project and you have to publish that. So it has to be accepted for publication. And then for my credentialing process, I had to write case reports. That is something that doesn't exist anymore. Now there are different processes that they use to replace the case report, but that was part of my credentialing process as well. And so what initially starts out is turning in a credentials packet, and that credentials packet has to include things like your publication acceptance, for me, it was my case reports, as well as letters from my residency mentors. And once that credentialing packet is approved, then I was allowed to sit for my board exam. My board exam took place. I actually had to go to Seattle to sit for my board exam. There were 5 of us sitting for the exam when I went, so it was really small. But it was a 2-day exam, and the sections of the exam were more biochemistry based, which nutrition is biochemistry, which I think a lot of people don't realize. But so the one section was biochemistry based, another section was clinical based, and then the third section is written. So the way, again, things are different now within the nutrition college, is the original research and publication requirement exists. It will always be there. There is still a board exam. There will likely be and again, this is where I'm not entirely clear on how all of this will go, but there will still be that final specialty board exam, which will include sections like what I took. So like that biochemistry, the clinical nutrition, the written section. And so there's going to be probably likely a general exam that everybody in ACBIM will take. And then there will be a more specialty exam that everybody will take. So. And it's a lot.
Sounds like a lot of studying.
It's a lot of studying. My residency gave me 2 months off to study, and I needed it. So so the time off that I had to study, I basically set up a schedule for myself for those 8 weeks. The reality is I had been studying for this exam from the minute I started my residency. I took nutrition courses on main campus at University of Tennessee that were metabolism based. So I took a macronutrient course in this fall, and then in the spring I took a vitamin and mineral course. And I was taking that with all the graduate students in nutrition. So it was very deep. And I used that opportunity to take those courses to really, these were obviously human nutrition, but for me, taking the opportunity to understand what's going to be different about the cat and the dog. Any presentations I had to do in those classes, I always made it small animal based, which was always interesting for the people in the class because, they're all human based, so they get to hear something different. And a lot of the notes and resources that I made for myself during that first year of my residency, I used for studying when I actually was studying for boards. But the 8 weeks that I had off before boards it was really stressful, but I made myself a nice schedule and I basically studied 9 to 5. I took a lunch break and then I went home and treated it like a job. So at night I had some quality of life. Obviously that got a little bit more stressful as the exam started getting closer and closer, but I tried to make sure that it wasn't just me like waking up at 7 a.m. and studying until I went to bed, because I needed some semblance of normalcy there. So.
That's really important, talking about like time management and kind of organizing yourself that way so you don't burn yourself out and you're able to chug on. And it's really great that you were able to devise a study schedule like that. So kind of what does, I know it's a little different from like working in clinical to working in the industry, but what does a typical day look like for you?
Yeah, so it's going to be different wherever I'm at. So if I'm in clinics, it's going to be me getting in and prepping my cases and seeing appointments and going home, or finishing my records and going home. Uh, when I'm in working in my industry job, it is really different on a day-to-day basis. So I work remote. So will I have a schedule that is a lot of times when I'm working from home is built on virtual meetings and some self work and things that I'll do at home. And again, it's mostly communication based on that front. But a lot of my job does involve traveling. So I do travel quite a bit. Conferences, university visits are the big ones. I also provide a lot of continuing education for veterinary medical associations. So I've done a handful of trips already this year. It's my first year working for an industry. So, but I provide a lot of continuing education, and sometimes that's in person and sometimes that's virtual as well. And so it's not always 9 to 5, especially when you're traveling, because like, for example, I'm going to a conference this weekend where I'm going to be working. And so I'm working Saturday and Sunday, but I'll take some time to balance the scales later in the week. So I basically don't end up working Monday all the way through the weekend through the next Friday, so I will have some work-life balance there, which is nice. And so there is some time management on the standpoint of that, to making sure that you're balancing that time. And so again, it really just depends on what my day looks like. And so this week, Monday through Thursday, I'm working from home, but I'm also going into the clinic a little bit this week too for some clinical cases. So it's different every week, which is nice.
Yes, that changes scenery. Okay, so kind of a interesting question for you regarding some of the typical cases that you might see. What's like the most common case complaint that you've seen that you're like, oh, it's this again?
Well, I think every single day that I see clinical cases, there's always a case with chronic gastrointestinal signs. So again, being a specialist, like, I'm not going to be seeing cases that are typically acutely sick, like
Hmm.
acute vomiting and diarrhea. Those always end up with their general practitioner or an emergency vet first. And with chronicity, they tend to make it to the specialist. And so chronic gastrointestinal signs is probably the biggest reason I see clinical cases. And so the kind of probably the two second most common cases are going to be urinary and renal cases. Specifically for me, I have some interest in urinary. And so I've established some veterinarians that like to send me their cases that are urinary based. When I was working full time at Red Bank Veterinary Hospital, I would do urinary consults for many of the cases that had procedures at our hospital. Uh, so that was a really common thing for me to see. And then renal disease, so chronic renal disease is another really common reason I see cases in the hospital. So,
Perfect. So I'm gonna give you kind of an opportunity to kind of really sell your specialty to the ones that are listening. So why should someone choose nutrition?
so I think every veterinary professional should be interested in nutrition, because every animal eats, and it doesn't matter what specialty you go into, or if you're a generalist or an ER doctor, all of your patients are going to eat food, and that food is potentially going to have some impact on whatever pathology you may be dealing with, or even just health and wellness. Every animal eats. So we should all have some interest in basic knowledge about small animal nutrition. Now, choosing to specialize, obviously, you would want to have some type of interest in nutrition. Our nutrition college is obviously filled with people who love nutrition and love seeing the value of that in practice, and love researching these topics. And there's really so much opportunity for good evidence-based medicine when it comes to nutrition in animals. But really for me, what's important is I want everybody to recognize how important nutrition is and how important it plays a role every single day in our animals. And a lot of humans recognize that is, I mean, a lot of pet owners recognize that as well. And when we think about what is the one way that a pet owner can impact the well-being of their animal on a daily basis and have this bond with their pet, is through feeding their pet. And so there's a lot of opportunity there for education. There's a lot of misinformation around small animal nutrition. As we all know, the internet and social media can be a really dangerous place when it comes to nutrition advice and nutrition recommendations. And this is something that happens with human nutrition as well. So there's tons of misinformation out there. And so I really hope that all veterinarians can appreciate and know where to find good resources related to nutrition to incorporate that into their practice.
That's perfect. I kind of said it better myself. It's very important. So I actually had some questions regarding kind of, we talked about like the communication between in your job between yourself and other veterinary professionals on consulting and advising on your products, and that research based towards the clinical aspect. Guess my question would be more along the lines of like, what are some of the, it's a compounded question here. What are some of the most misconceptions that, the typical person, typical pet owner might go into thinking this is like, oh, this is really, really important, or this is what I should be doing for my pet, but in reality, not so much. We'll kind of start with there.
So I think one of the biggest misperceptions that pet owners have around pet nutrition is really related to judging the quality of pet food. And so a lot of pet owners, they think that you can really just judge the quality of pet food by looking at an ingredient list. And there's a lot of marketing around ingredients, and there's a lot of marketing around our diet doesn't have this, which if it doesn't have it, that implies that that ingredient's inferior or a bad ingredient, right? So there's a lot of misinformation that comes around ingredients in pet food. And again, judging the quality of pet food just based on the ingredient list. The ingredient list doesn't tell us anything about the quality controls or the safety or the formula for the pet food. It doesn't tell you about the nutrient digestibility. It doesn't tell you about nutrient bioavailability. So there's a lot of things from a quality standpoint. When I think about quality of pet food, I want a diet that has all of the nutrients in the diet in the correct proportion, so the diet is complete and balanced. I want it to be for an appropriate life stage of the pet. I want the company who's manufacturing the food to ensure that the ingredients are safe when they're purchasing them. And so some ingredients are going to have some hazard associated with them. So you have to screen those ingredients when they come in. So they've got good safety and quality control measures when it's coming into the building. I think a good quality product is one we know that the digestibility of the nutrients is good, that it's been through some type of feeding trial or something, especially for growing animals. And not to say that there are foods out there that are bad that have never been through a feeding trial before. There are plenty of foods out there that a lot of animals really thrive on doing. But I think there's a minimum entry into pet food, and then there's a more optimal entry into pet food. And so the quality, for me, looking at ingredient list, you're really missing a lot of information by just looking at that ingredient list. Every body has been trained to look for meat as the first ingredient, right? Like that's a thing. That's just marketing. That's like totally marketing. And so people who formulate pet foods, they understand that. And so you'd be really hard pressed right now to walk into any pet store and turn over a bag and find something where meat isn't the first ingredient, because guess what? That's exactly what every single person knows that people are looking for when they look on that bag. And that doesn't mean that that is going to be a better diet than a diet that maybe starts with a carbohydrate source as its first ingredient, because the thing that animals needs are nutrients. They don't need the ingredients. They need the nutrients that you get out of those different ingredients. And so it's more important to me what the nutritional profile looks like and the digestibility of all of that looks like compared to just looking at an ingredient list. So.
Well said. Very, very important. Thank you very much. So I guess to kind of wrap things up, what kind of advice would you give to somebody that's like looking into knowing more about nutrition, trying to get into nutrition, kind of overall, what's that advice that you would tell them?
Yeah, so again, just recognize that nutrition is going to play a role. So for people who are wanting to go in the veterinary profession, I think it's important to understand like that nutrition is going to play a role every single day that you practice. And it really doesn't matter what specialty that you're going in. Like there's going to be something related to nutrition that is going to be important for you to know, even if you are a specialist. Like even if you're an anesthesiologist, what if you have a really obese patient that comes in? You need to, that's nutritionally related. So even knowing things like that, if you're an ophthalmologist, you're going to have patients that come in that are diabetic, that have cataracts, or they're going to have high circulating of fat in their body that's going to affect their cornea. Like even specialties like that, like you have to know about nutrition. And so sometimes nutrition is something in practice that can sometimes be really overwhelming because of all the misinformation that is out there. But taking the opportunity to learn certain communication techniques surrounding nutrition. There's a lot of good clinical tools. A lot of veterinary schools are teaching this now. But I think if you recognize that this is something that you're going to have to deal with in clinical practice, no matter where you go, and really take the time to, again, when you have a client that comes in the room and they're doing something crazy with their animal's diet, don't be like, this is wrong. Like, this is crazy. You shouldn't be doing this. Like, take the time to understand why they made that choice. They most likely made that choice because they think it's in the best interest of their pet. And guess what? You have the best interest of their pet in mind as well. So take the time to listen to their why about why they chose that, and then find common ground with that owner, and then talk to them about what you think from your veterinary perspective is going to be the best nutritional option for this pet, and explain to them why in the context of the pet health. And find common ground with that client. You both have the same thing in mind for that pet. You both want the best diet for that pet. So if you can work with clients from that perspective, rather than having them come in and being like, oh, I would never feed that to my pet, so you have to empathize with your client. Again, no client made that decision because they're trying to hurt their pet. Like, that's just not how it is. So I think there's really good communication techniques out there too that can really take some of that anxiety and burden away when it comes to talking to clients about nutrition.
Perfect. Well, thank you very much for joining in. Thank you very much for providing this insight. I've definitely learned a lot personally about nutrition. I feel like I knew it was important, but I was like, now that I'm like thinking about it, I'm taking an animal nutrition class right now. I'm like, yeah, okay, this is why. I'm learning a lot more about the like you said, a lot of it being biochemistry, and like why if like a dog ate like a chicken tender off the ground, why that can cause allergic reaction and whatnot. And I'm like, oh, this is a lot.
Yeah, there's so much, like, and even in my nutrition residency, like, I still have so much to learn, right? Because science is evolving all the time. Or to sometimes relearn, so it's you're constantly learning throughout your entire life. But nutrition is really fascinating to me. Obviously, I specialize in it, so, and I love to talk about it. But yeah, well, thanks for the opportunity to talk to you.